walk in and there's sometimes 30 people waiting to be seen in the waiting room. One of the biggest challenges and things that I've seen patients complain about over the past few years is I'm having trouble seeing my primary care doctor. I've tried to call the office, nobody's returning a call, I can't get a hold of them, and it's like patient after patient is saying these exact same words. Being a concierge practice, we're basically saying you don't have any waiting room wait times. You know, you're not going to come in and sit in our waiting room for 2 hours waiting on a provider to see you.
How are we becoming distinctive in our field? And it is truly built out of we love people.
You know, when we were praying about whether or not to even leave the ER and open this practice, I promised God, if this is your will, if you'll help us get the doors to this practice open, I'll use this to talk more about you.
We take care of you the right way, right away.
We need more people like you.
I put my hand up and I said, simply remember this. Smile means I live eternally. If you know where you're going and who's getting you there, why wouldn't you?
Welcome to this week's edition of Vision and Voice. Today we have Wes Stewart and Dan Cauley. Welcome to the show, gentlemen, and we'd love to hear your vision and give you a voice for Blue Wave Concierge. Welcome, Wes.
Yeah, thank you so much. I really appreciate it.
We're glad you're here.
Yeah, thank you.
Yeah, it's great to be with you. We've been looking forward to this, Glenn. I know we talked a little bit over the phone and been working with your great people here, and we're just honored to be a part, and really a passion that came out of a calling rather than a career is one of the big reasons why we're sitting here today. And God definitely has changed our world and our lives. And so I serve alongside Wes as his marketing and sales director.
Love it.
And of course, he takes care of the people on the front line. But we are here to serve this coast in a brand new venue, which is Blue Wave Concierge in Hope Sound, and serving the whole Treasure Coast.
I love it. So I was sharing with you off camera, you know, we have local providers ourselves, and it's always a struggle to get in to see somebody, frankly.
Yeah.
And so what made you found Blue Wave Concierge?
Yeah, it's funny you mentioned that. That's actually one of the things. So my background, I'm a nurse practitioner. I've worked for years in emergency medicine, the last 11 or so years up in Vero Beach, Cleveland Clinic, Indian River Hospital in the ER. And that's one of the biggest challenges and things that I've seen patients complain about over the past few years is I'm having trouble seeing my primary care doctor. I've tried to call the office, nobody's returning a call, I can't get a hold of them, and it's like patient after patient is saying these exact same words. So that was really one of the big kind of driving factors for us, you know, opening primary care, just to be able to connect with patients more and, you know, give them what they really need.
You know, we use the local here on the Treasure Coast. We use Blue Cross Blue Shield, who I've had 3 children with, and my children have had children now. We have 4 grandkids, and they've done a great job overall for major medical and that type of thing. But just for you know, preventative health care, getting to see, like when I get asked, who's your primary care physician? I don't have one right now. And so that's, I think they've done a great job. I don't want to say anything bad about them, but I think they have done a great job overall. But the day-to-day stuff is really difficult to do. So we're excited to have you here on the Treasure Coast. And your new location or your opening locations in Hope Sound?
That's correct. Yeah, about a mile north of Bridge Road. We're on the on US 1, right on A1 or US 1, Federal Highway.
So, and I actually just have some questions because I need to. I mean, I'm thinking of using your services, and we briefly spoke on the phone here. So as you, like for me, my children are older now. I do have a 12-year-old stepdaughter, but how would I utilize your services for like primary care? So I would list you as the primary care group.
Are you familiar with how concierge medicine works?
No, I'm not actually.
Maybe I could explain that a little bit to you and your viewers. So concierge medicine, essentially people are paying an annual membership fee. And then that is basically gets them in the door for the year. You know, you can come in once you're signed up, and, you know, we do labs in the office. We're partnered with Quest, so we can draw blood, EKG, yearly physical, and all the wellness things, and medication refills, and all the chronic disease management. Essentially everything your primary care doctor would do, but just in a less unrushed, a little bit better environment to really be able to sit down and connect. Being a concierge practice, we were basically saying you don't have any waiting room wait times. You're not going to come in and sit in our waiting room for 2 hours waiting on a provider to see you. And we give very just as much time as a patient needs. Like we'll block out an hour for a new patient that's coming in. And again, that's very different for, like I was mentioning earlier, from the ER where you get 5 minutes with a patient if they're lucky. So,
I mean,
and then
for sure.
yeah, and then I think also to answer your question, you were mentioning children. One of the things that kind of sets us apart a little bit, and we've had several parents that have already benefited from this in the past month that we've been open. We're telling, if a busy mom can't get in to see a busy pediatrician with her kid, I'm happy to see their kid at no extra charge. If mom signed up, you're worried about an ear infection, or your kid gets hurt or cut or something else, bring them in and I'll see them, no problem.
I love that.
Yeah, it's that easy.
Honestly, I go a lot of times. I just go to the walk-in clinic
Right.
now. But I have
Yeah.
some of our employees and some friends and family that'll go to the ER,
Right.
which is crazy. Obviously, it's tying up the ERs
Right.
and some that really is an
Yeah.
emergency
Yeah.
type situation.
You're absolutely right.
What I mean, at what point? What was your threshold of frustration being at the local hospital here? What pushed you? What was the one, if there was one event that
Yeah.
pushed you to launch your concierge service?
Um, I guess I need to be a little bit careful what I say. I'm still working in the ER part time, maybe a Saturday or two a month, just to keep my foot in the door there. So I got to be a little careful what I say, but I can say that it's very busy. I'll walk in and there's sometimes 30 people waiting to be seen in the waiting room.
Mm.
And so I wouldn't say it's just one thing. It's just things that build over the years of um, being understaffed as far as providers, and patients waiting and being frustrated, and just all those little things that just kind of build over time.
I know we've all experienced it, and so
Yeah.
I don't want, because they do
Yeah.
such a good job overall. My daughter had she was one of the last ones to have a baby in the neonatal here at Memorial. I would say Memorial North, but it's Cleveland Clinic North here on the
Right.
water, and I think they do a better job out west. They're in tradition now.
They actually shut down the labor and delivery here as well at
Yeah,
Barton North.
yes, it's done in
Tradition.
tradition.
You're correct.
My mother had a brain aneurysm, and thank God they sent her. They knew to send her out to tradition, saved her life. We really didn't think she was going to make it, or if she did, she wouldn't be able to speak. And the doctors were amazing; they were on point, and so I love to see that. And that was a major medical, obviously, but
Yeah.
for scrapes and cuts and all that good stuff. Would you say is that something you'll specialize in, or how does that work?
We can easily handle those things. So again, with my ER background, I'm very comfortable doing laceration repairs and procedures. Somebody has an infection, or ear infection or cold. We can test for flu and COVID and all those things in the office as well. But yes, I would probably be more comfortable doing wound repair, especially in the ER, or I mean in the office, just because of my ER background.
You've done lots of
Yeah.
stitches.
One of the things that we've actually done as well, we're partnering with local companies. We're essentially on a retainer with, like, we signed up a landscaping company, and we are their urgent care essentially. So if their landscaper gets cut on the job, don't go to the ER, don't go to urgent care, come in and I'll take care of it.
I love that.
Yeah.
So for a family of four, like like my family
Right.
and two parents, four children, what would that cost me annually or monthly? How does that work?
Sure. So it could be paid monthly, quarterly, semi-quarterly, annually. However, we have all that covered. Down the road, we're at $3,000 per patient, and that's for an adult patient.
Annually.
Annually, correct.
Got
What we're doing here to start with, since we're so new, we're giving patients a little bit of a break. The first 50 that sign up, we're at 2,500, so $500 off. And again, if you've got a child, under the age of 18 that's still living in your house, no problem. I'll just see them.
That's awesome.
Yeah, just
So
include
it
it.
reminds me, I grew up in a small town in Wisconsin, and Dr. Shikaski, so remember his name. His father, and then his son took over the practice, delivered my cousins, and then my mom, and my aunts and uncles. So if you had a scrape on a Sunday, they would call his house, and then he would go down to the practice, which is only a few
Yeah. Yeah.
blocks away. And it's more, so it's almost like that, like the original
Y
care.
Right, yeah, if somebody has an issue on a weekend, no problem, call my cell phone. If it's something where I need to go to the office to sew somebody up, that's fine. On Saturday, I'll take care of it. Sunday afternoon, no problem.
I love it. I love it. You get to
Yeah.
know your, that's a really rare thing today
Yeah,
too, to get to know your primary care person and
exactly.
helps take care of
Yeah,
everything.
yeah.
You know, I guess just as a question, we do some pre interview questions. Um, but what would you say is the key thing missing? And you might have already answered this. What is the key thing missing in today's healthcare? If there was one thing that
Yeah.
you started, Blue Wave Concierge.
Mhm.
Why did you start that? But what would you say is the one thing missing that you can give to the community?
Yeah, maybe I've touched on that a little bit already. I would say just the personal aspect of medicine, just to be able to spend the time with the patient to really dig into what they need for their own healthcare, and
Mm.
I think that's missing from what I've seen. Yeah.
I would agree with that 100%. When I go to and I hate to admit this, I just go to the walk-in clinic and whatever one's kind of on the way home or
Yeah.
close or doesn't have a long line, and so I'm in and out. They don't know who I am.
Yeah.
Oh, they're like, oh, you were here last year for,
Yeah.
I actually had an ear infection, which was the weirdest thing. I feel like I'm 12 again, right?
Right.
And they interviewed me, the doctor, they're like, well, do you swim a lot? I'm like, no. And then I was like, oh, I do cold plunges. So I'm like, it's the
Mm,
cold plunge thing. And so but as you work with the same person over and over, you're going to kind of get to know
right.
their history,
Exactly.
and
Yeah.
that's it's consistency.
Yeah.
We just don't know our doctors anymore,
Right.
frankly.
I
You
think
know,
with
And
him blocking an hour for especially the initial visit, it's not a force-fed thing. It's available to you, and the listening factor. When you have somebody that is calm, they've taken the time, it's already blocked out. You
Mhm.
haven't sat in a waiting room endlessly, not knowing when your number's going to be called next, and then you get to go share everything that you need to,
Mm.
taking notes all the way down. It completely changes the front end of that relationship to be able to care, and then
yeah.
availability.
Right.
That distinctiveness of, hey, even if the office is closed and there's really an emergency, this guy's going to do that. I mean, he's the new old school.
I love it.
Yeah, and that is actually a good point too. Again, I keep referencing my ER background because that's what I've done for so long, but I can recognize when somebody is sick and needs to go to the ER, needs
Yeah.
to be admitted
Mm.
because that's what I've done for years.
I love it.
Yeah.
That's awesome. I was thinking of Martin County, Stewart, St. Lucie County, and in Indian River too. We were 25 years ago, 30 years ago. These are really small towns.
Mm.
So you probably knew your doctor, all your kids went to school together. So you could call them up and say, hey, we have an issue. Hey, come in, I'll go meet you down there. It was like the mm, local hometown,
Hmm.
concierge service, right? You can't do that now.
Great.
I don't think
Yeah.
they're allowed to see you outside the larger hospital
Right.
Mhm.
network, frankly.
Yeah.
And so there's, of course, the liability and different things. So I know concierge doctor concepts are really taking off.
Mhm.
It's been very big the past 10 years at least. Just taking out a lot of our doctors that I've worked with in Vero have quit their own practices or, quit the ER to do the concierge medicine.
I love it. And the other thing too is as I get older, and you all know this, and I don't know where we're at in the age gap. You seem a little bit younger than I am, but
Thank you. I
all of
appreciate it.
my friends' parents that were doctors are retired,
Mhm.
Yeah.
and not as many of the daughters and sons went into medicine because their parents kind of discouraged them.
Yeah.
Mhm.
One or two, but it's just so different now. So there's such a huge need for what you're doing. If you get the right marketing message out, as you know, which is hard to do, Dan,
Mhm.
that's the key, right?
Yeah.
So, just out of curiosity, what is the marketing plan? How do you get this awesome service out there? That is
Yeah.
huge need.
Well, as whatever you want to call it, the elevator speech or the hook, we've often said we take care of you the right way, right away.
Oh, I love that.
So it's a bottom line thing. Get it right the first time because we've listened, we have the background, we have the experience. Now you're into this great setting. It's a brand new, beautiful facility. When you come in, you're refreshed by just getting there. And then the mood, the content of where we train our people, those kinds of things. Then you get to see the person who's going to care for you right away.
I love it. And
and the
you're
stress level goes down.
that's on my way home. I had to take US 1, but it's actually on my way home. But you're open. You're fully open
We're
right now.
open. Yep,
You're
we're
open.
seeing
April
patients.
1st.
Yeah, I had to
We
put
have
a sign on my door saying we'd be back after lunch today.
Oh, there
So,
you go.
we're open.
Well, thank you for being here.
Yeah,
Sorry I was late,
that's
and I
okay.
appreciate it. But I will be. I'm going to say this now because I'm going to sign up.
Okay.
So, and you have a little bit of a discount, so I appreciate it
Yeah,
because I need that just so if I have an issue
right.
and, I'm at a point where I need to do you do annual physicals,
Absolutely.
all that,
Yep.
all the blood work,
EKG
everything I need.
labs, absolutely.
All right. Do you have the treadmill there and all that or no?
We don't have a treadmill. We
Yeah.
could put one of those in, Dan.
Yeah.
Custom. Yeah,
Yeah.
we've got that's basically what we're talking about here. It's custom healthcare,
Yes.
and what you need is what we become.
God, I don't. I had an EKG a long time ago. I always thought you're on the treadmill. They got stuff on your shirt,
That's
your
a
heart.
stress test is what
Oh,
you're
Yeah,
thinking about.
got
Yeah.
it. Stress
So
test.
cardiologist would do that.
Oh, got it.
And that's a good point too. We've, with the marketing that Dan's been helping us doing, we're setting up a really, really good referral partner network where if you need a cardiologist, if I'm seeing something that I don't like in your physical, for instance, or on your EKG, for instance, we're able to call a cardiologist and say, I've got this patient, whoever, I need you
Mhm.
to see them, sooner rather than later. And we're helping people get appointments.
I love
So,
that.
yeah, urology, ophthalmology, it doesn't matter.
You,
Orthopedics,
can
anything
you
needed.
get me in if I needed to see a heart specialist or something? Could you get me in maybe a little sooner? Or
That's what we're working on. I mean, our office, we'll call directly for you and not expect you to make your own appointment.
I
So,
love it.
yeah,
access is a big thing.
It is.
It's not just, oh yeah, well, September, does September work for you? No, it's this week,
Yeah.
and then we have the relationship.
It does make a difference, right? So I know, and I don't, back many years ago, if you knew the doctor and you'd call them up, they'd be like, like, I'll get you in today, or this is an issue, I'll get you in. And they would,
Relationship driven.
it really was.
yeah,
It's not as much now, but it was.
Hmm.
And it's great you're doing that because it's really the key to what you do in sales and marketing
Yeah.
and growing a company. But in medical, it's so personal.
Right.
I don't want to be another number.
right.
And sadly, I mean, I understand it, if you're in an ER and there's an emergency, that's one
Right.
thing. But
Yeah.
just for your annual checkup, annual care, it's nice that you know who we are.
Exactly.
Which
Well, then the
is a-
secondary part to answer your question about what's our messaging and how are we becoming distinctive
Mm.
in our field, and it is truly built out of we love people. So this calling is guided by the fact that God loves us for sure, and He showed His love to us. But then we get to imitate that. So because we truly love people. When I'm with people all day, I'll finish up about 8:30 tonight by the time my full day is done. And I'll still have people calling or texting or what. I love people. Wes loves people.
Yeah.
And that's why he goes global with it, not just here, but I mean he's in Africa and all kinds of nations and serving because we love people. And that's it.
Yeah.
That's our
I
difference.
love that. So it's these are God-centered.
Right.
I know you have two other charities that you have founded and
Yeah.
non-for-profit, so we'll get to in just a second. But I mean, that is what's missing in healthcare.
If I can say, when we were praying about whether or not to even leave the ER and open this practice, I promised God, if this is your will, if you'll help us get the doors to this practice open, I'll use this to talk more about you, and just love people and want to share Jesus.
I love
we
that.
we love the Lord.
So during your consultation for I don't know, stitching, you might
Right.
if we'll
Yeah.
talk about that.
Yeah,
And,
sure.
faith in medicine
Yeah,
has been lost probably,
Yeah.
frankly.
Yeah.
We're relying on man, and it's you got to do both, right? God has
Yeah.
given you these gifts, and now you're using those gifts to help heal people.
yeah.
But faith and prayer is key, right?
Yeah.
If
So,
I could, I actually wrote down two verses if you'd like to hear them,
I
and
would love
it's
to.
kind of been sort of some guiding verses for me over the years, both in missions and now carrying on into this new practice. Acts 20:24, I'll read it. Paul says, "My life is worth nothing to me unless I use it for finishing the work assigned me by the Lord Jesus, the work of telling others the good news about the wonderful grace of God." And then in Second Timothy, he kind of takes the thought to the next level. 2 Timothy 2:10, he says, "I'm willing to endure anything if it means that it will bring salvation and eternal glory in Christ Jesus to those God has chosen. And who's God chosen? He's chosen all of us. We're all his
Yeah.
people, right?
I love that.
So yeah, that's kind of
I
been
want to.
our guiding thoughts.
Those are great.
Yeah. You want it? You can have
I
the
was going to say that almost should be a mission statement on the wall here.
there you go. You
Centered
could
mission
that's
statement.
my gift to you today.
I really appreciate that. You know, we've had this media company for about 28 years, but I'm a second generation printer publisher. This is our 50th year,
That's great.
youngest of 9 kids. And I always knew God. I grew up Catholic, always, knew God, and everything that went with that. But there's a difference between knowing and living it, right?
Mm.
And so I call it born again, born again. And so
Mhm.
I was called out about 2 years ago, and God's like, we want you to scale this company up and have a God centered company. And I'm like, well, me, God, I'm just a regular human. I'm another sinner trying to do better.
Mm.
But he's like, yeah, yes, my living media. And he brought people like yourself here. There are no coincidences, right, in life. And
Right.
so I read the book God Winks, and this is like a God wink, right? And this is great. Thank you so much for
Yeah,
sharing
yeah,
that.
absolutely. Thank you.
And so I used to think, oh, well, that's a great verse from the Bible. But now I realize that God has his hand in all of this, and
Mhm.
he's helping us lead to do his will on this earth through
Yeah.
the gifts we were born with,
Yeah.
and
Mhm.
he's like pulling them out
Yeah.
of us. We already have them. Sometimes we didn't use them, frankly. And so getting quiet and listening to God's will. Um, I grew up in the church, but this is the first time I'm listening, God. I look,
Yeah.
and
Mhm.
it can be easy on the mornings you get quiet, you put your phone down, but then the
Yeah.
world can really distract you,
They can.
as you know. And
Absolutely.
so, and the fact that you said you like people, as sad as it is to say this, that's somewhat rare these days.
Yeah.
We all know business owners that some guys can forget that it's a privilege to serve, right?
Yeah.
It's an honor to serve.
Yeah.
And so that's pretty cool.
We get
And
to do this.
yes, we
Yeah.
get to this. We don't, yes,
Yeah.
it's so true. It's so true. And thank you for saying that. I love to hear that. And so I'm excited for the Treasure Coast and for South Florida to have Blue Wave Concierge. It's huge.
Yeah, thank you.
And, you know, you can, a lot of times I can tell, and you can tell who people are, not by what they say, but by their actions.
Yeah.
And so by opening this up and having God centered marketing and caring and liking people still,
Yeah.
um, we need more people like you to do that, like both
Yeah.
of you. It's it can be rare. I'm hoping one day in a few years from now, it's not as rare as it is today, and I see a revival. I'm sure you see it too.
Yes.
It's
Yeah.
definitely happening.
Yes.
Yeah.
You know,
Yeah. So if we love God and are serving God in our office, we can impact our community and then impact the world.
yeah,
Yeah.
one patient at a time.
One
For us, it's
patient at a
one
time.
client at a time.
Yeah.
Yeah.
So we deal with small businesses like yourself and some of them want to scale up. I don't know if I mentioned we worked with Ryan Blair with Altar Call, and he
Mm.
takes smaller companies, $10 or $20 million, God centered, and helps scale them up for the kingdom
Mhm.
to 100 million or 500 million or
Wow.
more.
Yeah.
Not for the money. Obviously we do want to take care of our families and
Mhm.
our families, our employees, and
Yeah.
everything. But you know, it's kind of the new. Ryan says it much better, but it's like the new battleground for the kingdom, for God.
Mm.
Through God-centered businesses and caring about people again, like liking people
Yeah.
and
Yeah.
knowing that we're all
Yep.
sinners trying to be better and
Yeah.
grace and forgiveness.
Yeah.
Forgiveness is the keys to the kingdom, right?
Yeah.
And giving and forgiving ourselves and having grace and giving grace is always
Yeah.
awesome. So
You show somebody that you love them, some random person that you've never met. You show somebody that you love them. It's amazing what kind of change you can make.
it really
Yeah.
is. I have to remind myself of that because, as you know, you deal with the public, and sometimes they come in and they're not nice, they're angry, and I always say you pay the price for in media and advertising sales and marketing and we help companies grow one
Mm.
client at a time, and they need clients every
Right.
month because people retire, they move away, they pass away, different things. And so but sometimes they're pretty tough, they're tough and,
Yeah.
and you have to give them grace because we were given grace,
Yeah.
right? And so
Sure.
it's a nice reminder.
Yep.
I fail sometimes, frankly, but I know I surrender to God every day, and then tomorrow's a new day,
Yeah.
and each day goes better. So, I wanted to talk. We'll talk a little bit more. Is there anything else you wanted to say about Blue Wave Concierge? If there was one thing you would want people to know, what would it be? What would be the key thing? Why would I want to go to Blue Wave Concierge?
The key things, I guess we've hit on a little bit of that, that we're going to love all our patients. We're going to treat each patient with respect and give them the proper attention that they need. And then, if there's something that we can't take care of in the office, we're going to get them to the right person that can. And that's really I guess, the short version of Dan. I don't know if you want to add anything else to that, but
I think because this whole thing is driven by principle
Mm,
versus preference,
mm,
getting what we need is really important instead
yes.
of just what we want. And whenever a person comes into a conversation or a relationship and they're just like, hey, what's in it for me? Or what do I get? Or, what do I want? When it's built out of the premise where we're going to bring them back to what does God want?
yeah.
Or,
Yeah.
what is the
Yeah.
principle that we don't have to figure, does this work? We know it works. And I read your core values coming in, and those core values I think are super important to why
They
we
are.
exist. It's not we're not here by accident. Coming into this office, they're going to notice that right away. It's about what works,
Mm,
not just about what you want, but in doing so, you're going to get what you need.
I love it. So principle versus preference.
Yeah,
I love it. I love it. It's truly a servant's heart, would you say? That's
it's
how
a
I see
yeah,
that
it's a, yeah.
basically.
We find the
That's
best
good.
when we've listened. We start with the premise of what works to get what we need.
On the core values, on the bottom I put the definition of that. They're spiritual aspirations, right? And I
Beautiful.
Googled the definition of aspirations. Have you ever Googled it? Didn't come across right. And I'm like, well, let's try spiritual aspirations. And it's basically doing thing not for just for you, but for God, basically, right? So doing things how would a faith-based person deal with this situation? How would a Christ-centered person deal with it?
Yeah.
And so I have to admit, I got a lot of those from Cap Chatfield,
Okay.
but they're tried and true from the Bible. And,
Mm.
we try to live that every day. And we do the EOS system from the book Traction.
Mm.
If you ever use that, it's a system to scale companies up.
Okay.
But when you look at each employee and you ask, do they represent your core values? And you go down each one, and if not, where could we work? And none of us do, right? We're all, striving to do that.
Yeah. Yeah.
But to strive to do something outside of yourself, not just for yourself, for you win, I get paid commission on this, or I have a client, but how can I serve that client? How can I
Yeah.
serve this patient?
Yeah.
It's such a better patient focus.
Yeah.
And if you do that, I'm an old school salesperson. So
Mhm.
Zig Ziglar used to say, if you help enough people get what they want, you
Yeah.
can have everything you want.
Yeah.
Get rid of the stinking thinking.
Yes, that's him too, actually.
Check up from the neck up.
Yes, no, I love it. I love it. Well,
Yep.
Dan, on that note, I think we could transition over into you have a non-for-profit. Is it Renew Nation?
Renew a nation, all one word.
Renew a
We
Nation.
created our own word when we had the concept. And my best friend Jeff Keaton, who's the
Okay.
founder and CEO, we have lived our lives together because our dads are best friends.
Okay.
And then on all the way back, my great grandmother came to Christ and began a nonprofit that has impacted Haiti greatly. That we built 15 churches there, and out of this generational legacy, um, Jeff and I were compelled because my life's calling is new generations. So I've always been about the kid around the block who's never heard, or gang related things, or God's called us to the front lines. We've run with skateboarders and BMXers and lost people groups within the young people of each new generation. So obviously I've got some chrome now, so I've been around a few decades, and we just keep coming back to the new generations. What are they looking at? What's important? Where are we at? And Renew a Nation was birthed out of that approach to what are we going to tell them
Yes.
when they grow up? What are they learning
The
now?
next generation.
The next generation, that new kid that's coming around the corner. And now we went all the way through the alphabet. So Z's, they're up and running. We probably work for them mostly. But what about Alpha? Alpha's already on the scene, and they're taking over the world
So
up to
what is alpha?
16-year-old. Yeah, so
16-year-olds?
yeah, and below. They're already like running stuff.
Yeah,
And
some of them are with AI and
they're amazing people that I often tell. I have 7 grandkids now, and so and they're all about generational change. They're helping plant churches in Titusville, the Way Church. My grandbabies are right in the middle of that with my daughter and son-in-law in Titusville, Florida, and then Frisco, Texas. My son came out of the military, and he and his wife are helping a lot of their friends plant a church in Frisco. So my other 3 cowboys, I call them in Texas, my grandsons there. But it's about legacy, passing that storyline down. And as Wes has done, we've been raised in the faith, and the concept from the word is, to whom much is given, much is required. And that's not a burden on us.
Mm.
It's the responsibility to give. And so, however many hours a day, I don't try to count hours so
Mm.
much. And I tell people, they're like, well, so how do you get all this stuff done? And I said, well, God has given me 4 days per one. 6 a.m. to 12 noon is 1 day.
I
I
love
get
it.
so much done from 6 to 12 that I could probably lay it down and go fishing if I really, was just like working
Sure.
on minimums. But 12 to 6 at night is another day. I have day 2. And whatever I complete there, which a lot of times is just a full rung of things, and then 6 to midnight, that's day 3, and then I sleep on the 4th. So I
I
get
love
4
it.
to 1.
These
It's
they're old saying, we only work half days
yeah.
at, it's an old saying, that's 12-hour days,
Yeah, we don't
half
care what
days.
you do with the
Yeah,
other 12.
that's 12, right? You're working 18.
Yeah.
It's an 18-hour day
Well, and I
approximately.
take breaks in there. So you you
Yeah,
you have to find balance. It's all about balance. And so,
it
tomorrow
is.
night we're fishing. Like we're going to a local area. We're going to have some fishing time to break it up, but we'll still be working about some stuff.
Sure.
'Cause,
Fellowship time. Is
yeah,
that
if you
fellowship
do
day a
what you
little bit?
love, you never work a day of your
My
life.
1 day off for the whole spring here.
Oh, got it. I totally
Yeah.
understand.
Yep.
By the way, Titusville, we have magazines in Titusville, so
Okay.
we could do some
Yeah, the Way
so
Church, they are
donate to that
launching
too.
here pretty soon. So it's great.
Titusville, many years ago, back in 1991, I sold my first account to Love Mobile Homes in Titusville, Florida.
Okay.
They're still there. That was, I don't know, that's a long time ago.
I think I know. I've been up and down
Yes,
that
Love
pike.
Mobile
Yep.
Homes, Titusville, Florida.
Yeah.
So, well, I love that. And then Frisco, Texas,
Yeah, Frisco,
starting a
Texas.
church. I
Yep,
love it.
Connect
Connect.
Church. But many of these kids have come out of our emphasis when we started Renew a Nation. It was to offer biblical worldview education for millions of kids. Well, there's about 50 million plus in public schools in the United States of America, kind of your captive audience. Well, who's ministering to them? And we've got a lot of great causes, a lot of nonprofits across the country for decades that have been doing Christian clubs and
Mm.
coaches. And you've got great things. But who was also birthing those private schools, coming alongside that, helping that to grow and then fund it. And Renew a Nation has become a national voice in creating environments for parents who want choice, either homeschool, private school,
Sure.
to create the environment so where they can have, we know perfection, no one's perfect but Christ.
Correct.
He lived it out. God is perfect. While perfection is not attainable for us yet, excellence is. And so, whether it's a medical practice, a school, talking to a kid, we're all about excellence.
I
Let's come
love
out
it.
with our strongest game built on principle, and we can win this.
I believe
We can win it.
we can.
We are.
I
There is a
believe.
revival. I agree with you. There's a revival right now.
We do some work with PragerU,
Okay.
great organization. They are faith-based. And so, but they're doing, it's the Scholastic Book Club?
Yes.
Yeah.
Yeah.
And so they have their own book club
Mhm.
that my understanding is that's kind of how it seems like the adversary has been able to get to our children through very woke, it's a woke agenda that
Sure.
somehow
Yeah.
got into the public schools.
Right.
And so they have their own book
Mhm.
division that's going to go after that, which is awesome. Maybe I can connect you guys. So
That'd be great.
on the biblical world education, are you doing books, faith-based books?
So we do not necessarily publish books ourselves, but we have partnerships. And so large publishers that are very biblically based. So Ken Ham and his answers to Genesis. There's a lot of
Okay.
great stuff that, if you've ever visited any of his, like his museum or have been around the Ark, which is, you see it advertised quite
Yes,
often.
that's in Orlando, correct?
That is up in the Cincinnati area and
Okay.
just outside of Cincinnati
I'm
in
not familiar with
Kentucky.
Ken Ham. I should be.
Ken Ham is a big name and out of Australia originally, but he
Okay.
has talked a lot about creation and versus evolution, and that's where a lot of his fame came out of. The
Got it.
things he talked about. But Bob Jones Press, University Press, are some of the frontline uh, providers with curriculum, and Renew a Nation has, along with others, they have come alongside us because they saw the vision that we had for every student,
Mm.
and they provide curriculum for thousands and thousands of kids. But we've partnered with them a lot. They've invested in our vision and those things along with others. But we found that when a child is brought into a format, an environment where truth can be shared without reservation, and then emulated or modeled in front of the children, many of the behaviors change correctly,
Yes.
and the scores come up. It doesn't fix everything, but it gives you so much of a better format. And so we're generationally deep with that now. And so my grandkids are 6 generations deep in the faith, but
Wow.
they are raised with biblical worldviews. And in education, that's where we have found a lot of change. Now, has everybody gotten it? No, that's why we're that's why we're doing what we're doing, and so. Some of the new tax credits that are coming up are making better ways and views
Is
for
that the
that as
big
well.
beautiful bill,
The
correct?
big beautiful bill, yeah,
Yes, you brought
yeah,
that up earlier.
yeah.
So
Like it, hate it, whatever. It's giving provisions now for parents to make choices with some of their tax dollars to be able to take up to 1,700 per person that files. So husband, wife, if they're separate, up to $3,400 per household. They can designate that right off the top of their taxes and put it into a school of their choice. So if they have a private school that their kids go to, you cannot designate it to the child, but you can give it to the school, and then the scholarships are divvied out that way.
that's awesome.
Yeah.
The homeschooling used to be kind of, I hate to say it like this, but looked at as kind of weird. Oh, I'm going to
Sure.
homeschool. Now I feel it's mainstream,
Mainstream.
right? You would agree with that,
We've
right?
come alongside and have partnered with many families that are getting it right, and
I love that.
it's beautiful.
We went to Life Surge. They had a Life Surge in West Palm Beach back in, I think, January or late December. And I always think when Tim Tebow, was
Mm,
recruited, and back in we were really into college sports here in Florida, of course,
right?
and he was homeschooled. I thought, well, that's kind of weird. How did he play football, right? And I
Yeah,
guess they partnered with local,
yeah,
great schools and that had great teams. But now I want and hope my 4 grandchildren and counting are homeschooled because they can control the curriculum. They can control really what goes into their minds. And sadly, with what we talked about earlier, some of the woke culture
mm,
within schools, you just don't know what they're getting. Yeah, even here even in Martin County, which is an A-rated school system,
right.
I think St. Lucie County is considered a good school system, but I
Sure.
don't know what the definition of good is.
Yeah, compared to what?
Yeah, compared to what? Right.
Yeah,
So it makes me nervous,
all right.
And then uh, private schools, I think, are good,
Sure.
obviously good, but there's some of that in some of the private schools also.
Right.
And so, but homeschooling seems like a safer bet with the curriculum.
We have a lot of people that, even if they started a private school, Christian school years ago, sometimes it's generationally led and then it dips or it almost goes out of business or the quality drops. We're all about coaching and coming alongside those administrators, those teachers to figure out. And you might find this, a lot of people don't know that a biblical worldview is hard to come by sometimes. A lot
Yes.
of people are like, well, I believe in God. And they think that's a biblical worldview. But the way you were trained and the way your mind was guided is really the fabrication of a biblical worldview or not.
Yes.
And we give a test a lot of times when we come in for assessments, and we'll go to a Christian school, and they'll have this great operation going on that's Christian, and we'll give this assessment to them, and we find out that a great majority of their people don't even have a biblical worldview. So then they wonder, why is it hard for us, to fill the gaps? and you can't give what you don't have. And so we are all about making sure to come alongside even staff, faculty, administrators that are presently operating great Christian schools or at
Sure.
least good Christian schools and helping them become really centered in what a biblical worldview is.
You know, if you would have had that conversation with me 2 years ago, I would have not understood it.
Sure.
But I get it more and more every day, you know, and it's very, very true. Wes, you're with Dan's a sharp guy here.
He is a sharp guy.
He's very sharp.
He's very sharp.
And now, Dan, so that's Renew a Nation.
Renewationation.org. Check 'em out. Yep.
Renewnation.org. Love it. What would you like the viewers to know about Renew? If you had in a 30-second elevator pitch, so to speak.
Yeah, we truly are coming alongside parents, churches, schools, and really a nation that is turning back, I think, to God. There is revival on college campuses and all this, but and churches are coming everywhere. They're starting to get this thing of love, and we love people, so
Yeah.
we're bringing them to the truth because we want to give the best thing we know, and that is if you come to Christ, He will literally change your life.
Amen.
The sooner the better.
Love it. I love it. And that's the core principle of Renew a Nation.
Yeah, offering millions of children a biblical worldview education.
Thank you. I love it. So now we'll transition to you, Wes, and
Yeah.
your non-for-profit.
You can see why I'm using Dan here for my marketing, by the way.
I can totally see because I'm blown away. You got a
Honored.
radio,
Yep.
you got a radio voice,
That's right.
and they always say, does he have? And you could be on a camera also. So they say if they say you have a radio voice, usually they say you're not made for camera.
Right, yeah,
You got
I-
both. You got
um,
both for sure.
Uh,
What is the name of your marketing company, Dan?
So I just freelance for myself,
Okay.
and I have not necessarily tried to take it out in that zone.
Oh.
And so I just my personal relationships have allowed myself to be used as God has. I've pastored for many years, and so within those networks, people will call me and say, "We know you have a lot of experience here," and so it's me.
I love it.
Yeah.
Did you meet Wes locally here at Christ Fellowship, or how did that?
Yeah, that's a good question. We kind of everybody knows everybody around here. Is that?
Yeah, we have a lot
what
of
we're
common
saying?
roots.
Yeah.
And one of my business partners was very glued to this project. And he said, Dan, I know you're taking a year off right now to be with your kids, but could you spare us some time with your expertise and relationships? And so I felt that God directed me to come help Wes in an area where I used to live and have many connections up and down. And so we met each other through a common business friend.
Yep.
I love it. And then a couple more questions
Sure.
for Dan. So Dan, and so how long have you lived here locally in Hope Sound, right?
Yeah, I was here in the early 90s finishing up my bachelor's in religious studies at Hope Sound Bible College, and which has been around decades, and quite a tradition of leaders within Florida and beyond.
Yeah.
But I met and then in more recent times, I've kept all my friendships and I collect friends. So over the years, we've just kept all these things alive and well, and tap into it when you need to.
I love it. And you're currently living in
So yeah, I'll be in Roanoke, Virginia. Yeah, and with Renew a Nation, our headquarters is there. And so, like I said, I took this last year off to rest a little bit. I hadn't taken my foot off the pedal for a while, and just spent it with grandkids
I love
and
it.
my children, and they're planting churches. And so, coming up May 15th, I'm back at it as a national director for all of the scholarship program in Renew a Nation.
Wes, he says he took a year off, but I don't know.
Yeah.
if that's-
He didn't really take
I was
it.
going to say,
We may twist his arm a little bit, even when he's up there. We may
Yeah.
get him to swing back down here a few times too. We'll see.
So I do have a company that is shaping right now to answer your question. It's literally called Steel Strategies Global. And steel doesn't necessarily mean just metal,
Yes.
but there's a fabrication that goes through that, and people can contact me, and I can leave my information here as well.
I would love to have it. It's because we deal with about 1,000 small businesses, and
Right.
they need consulting all the time, especially biblically based, God-centered consulting.
Love to serve them.
Yeah, so I
And
love it.
out of about 4 decades of ministry, business, education, and we're in global gaming. There's all kinds of things that we have come into by God's call
Yes.
to the kids.
Love it.
We care about kids.
Love it. Well, thank you. And so, Wes, now you're with the charity also. a not-for-profit that you
Right,
started.
right.
Mission Illuminate.
That's right. Yeah. So we started that a few years ago. My other background and passion, I guess you could say, outside of the world of medicine would be photography and video and media and things like that. And I do that some on the side for the church that we attend. And back in, what was it 2018, I was doing photography at church, and one of the church pastors asked if I would attend or attend. Go on a missions trip to Haiti with him to be able to capture what he did, because he didn't feel like at the time that he was able to, get the appropriate pictures and video and things to show off really what he was doing. And so I did. I went, and it was an awesome trip. We worked on building a clinic for a community that had nothing for miles and
In
miles
Haiti?
around in Haiti.
What
Correct.
town in Haiti?
Ooh, it was basically a village,
Oh,
a village that, it's an hour down a dirt bumpy road just to get there, and they had nothing.
our
So,
controller,
y-
Cristal, is from
Yeah.
Haiti, and she's lots of family there, goes back and
okay,
forth. And Haiti is a country in need, a Christian country,
yeah,
but with I know they have other things going on there
many
too.
needs. Yeah, it's outside of the city of Gonaives.
Okay.
So a village about an hour outside. So yeah, I went on the trip and it was awesome. Out of that, I ended up being invited to be on the board of his nonprofit, and I helped him out for a few years. That nonprofit was called Go Build Love, and they're still they're functioning. They're here locally, and after 4 years or so, I felt like I should leave Go Build Love and start my own nonprofit, as you mentioned, called Mission Illuminate, to
Yes.
do the same thing. And we open that up to other Christian missionaries and mission organizations. And our goal is to illuminate the Christian work of others. And that's simply it. So, I've been very privileged to be able to go all over the world and be able to photograph and video and do things that I never would have been able to otherwise. I mean, even just last year, um, went to Colombia and El Salvador, where else? Guatemala,
Wow.
and we help people here locally too. Mary's Home here locally in Stewart, I've done some fundraisers for them. So, it's not just about travel overseas, but we help wherever we can. And it's just to provide photography and video for those that need it. And we do it free of charge through the nonprofit.
I love
Yeah.
that.
Yeah.
It goes with our mission, honestly,
Mhm.
too, is to take media back from the adversary,
Yeah.
to take
Yeah.
God's message and,
That's great.
to the four corners of the earth, right?
Right.
Uh,
Mhm.
we work with Kurt Landry Ministries,
Okay.
Rabbi Kurt Landry, and
Nice.
he calls it the Media Mountain. And so we've been called, I think you've been called too,
Yeah.
to take
Yeah.
back media from the adversary,
Mm.
one client at a time.
Yeah.
It's so powerful, right? The new media
Yeah.
is so powerful, and it can be used for, obviously we see what's used for
Yeah.
bad things,
Right.
pornography, all that stuff.
Yeah.
Social media, is good and bad, right? The kids are they're losing the way to communicate because they're always on their phone, and we're in that. We do social media marketing
Right.
and podcasting, obviously, and we're traditional media, also
Yeah.
direct mail, print,
Yeah.
magazines. But it can be all of that can be used for good and for bad. Someone used the example of gold. I
Mm.
think it was Johnny Lee Reynoso, our sales trainer, and he said, I guess and please forgive me because I'm new into the Bible verse, but I think that gold was used. They melted it down and made when he was up on getting the Ten Commandments and came down. They used gold to use to make a
A
use
cat,
that as
an
a
idol.
calf, yeah, an
Yeah.
idol.
Yeah.
Old
There you go.
expression. Yep.
A
Yep.
gold private, so it can be good and bad, I guess. And I
Yeah.
didn't say that
Yeah.
eloquently, but but media can be used for good, so
Mhm.
much good and so much
Yeah.
education, God centered, Christ centered,
Yeah.
and so it's pretty interesting.
Yeah. Oh, one thing I didn't refer to as well, it's actually pretty cool. It has allowed me, if you come visit our office, it's allowed me to put up all of our offices decorated with my photography. And and that was one of the ways I said, I want to be able to share more about Jesus from my office. I've got all mission photos in the exam rooms and in my office. And, it's just really, really cool.
Starts the
It
conversation.
starts the conversation. Exactly.
Love
Yeah.
it.
Yep.
Excuse me here. I gotta.
Serving people,
Yes.
you hit on it a while ago, is the essence. When you love people, you serve people.
Mhm.
The outcome is generously deep. It's just a whole different format than just somebody out there patting people on the back or surfacely trying to prop them up or affirm
Yes.
them. But it literally, when you invested something, blood, sweat, and tears, as they used to say, it changes a life because there's gratitude then that comes and trust and all these other things that really come out of what we call the life in the spirit, which is
Mhm.
God Himself living
Yes.
in you. And while none of us get it perfectly right,
Yeah.
we strive as men in leadership to give of ourselves at the best of what God has given us,
Amen.
and that's what changes everything.
It does actually. It's I call it a servant's heart, right? You really have to care.
Yeah.
We're trying not to swear here at My Living Media. We're not
Sure,
getting better.
it's a
Still have a
great
long way
goal.
to go. But I would say something that you have to give a blank. You have to, and I try to treat people, if I was talking to my son or my daughter or my mom or my dad, would I recommend this marketing piece, package, whatever it
Yeah,
is?
right.
And if I can't say that, I'm not doing it. Right. And so there's
Yeah.
probably better ways to say that. I just treat people like I want to
Mm,
be treated.
that's it.
Right.
Yeah.
The gold rule every
And
Yeah.
time.
it is the golden rule.
Yeah.
And it doesn't, marketing is kind of an intangible. It's an
Yeah.
idea.
Mm,
As opposed to like a car or an iPad or something, it's good, it's bright, it's great. And it's a little harder, can be, to sell an idea. And, there's branding. And as you know, you're in that world.
oh, yeah.
It goes hand in hand. And some of it is a faith move. And I said, when you're doing this, there's no guarantees that this marketing is going to work, whether it's with Meta or with direct mail marketing. But if you do these things that I've done, the gifts that God has given me for the last 28 years that
Mhm.
I've owned it and 50 years as a family, um, it should work for you and work well
Yeah,
for certain categories. And if we don't know, I always say, you know what, this is a category we don't know, but I
Yeah.
think
yeah,
it could really help you. You won't know until you try it. And we'll do, based on our analysis, we think we can do something here.
yeah,
But some people will, well, as you know, the old times, they'll sell anything to anyone just to make their commission or do whatever. And
yeah,
it's so
Yeah.
wrong.
yeah.
I've seen it, and we've all seen it. And I believe in our company, it happens,
Mhm.
but we try to. This is a great garden to grow in, but if that's what you're doing, this is not your garden to grow in.
Right.
Yeah.
And so we have to weed the garden sometimes,
Sure.
like we all do,
Right,
and then but be the example we want to see in the world.
right.
Yeah.
Does it be the
Yeah.
change you want to see?
Product driven, and by product, it's something that I deeply believe in, and people have often kidded me, my family and friends, because I've had, consultation work and different things, and even in faith, when I've led congregations or nonprofits, you have to believe in
Yes.
what you're saying,
Yes.
or it becomes, like you said, just for the kicks of it, or can I make another buck?
Sure.
Yeah.
That's not worth it for me.
No.
What's worth it is knowing the why, and then the product comes out of that, and so really it's a healthy
Yeah.
patient that has had the right information, the time to care, and they come out, there's our product,
Yeah.
and it speaks for itself.
Yeah.
And as a kid is changed, that's it. The product yells, and the story is voiced, and you don't even have to promote it. It just sells itself.
I love that. That's
Yeah.
for Renewination.
Renewation, Blue Wave Concierge,
Yeah.
we're in this thing to win it.
And mission illuminate,
Yes.
Yes.
which you're helping missions do some of their marketing.
Essentially, yeah.
I love it.
Yeah. Yeah.
And that's bringing the word of Christ and God to the people, to the
Right.
masses through media.
Yeah. Just another way of sharing the gospel.
I love it.
Yeah.
I shouldn't say, the gospel is the good news, right? It means
Right?
the good news. I'm sure I heard that as a kid. I grew up Catholic. I was confirmed. But about 3 years ago, listened to a sermon with a friend of mine, and I'm like, "The gospel." He's like, the good news, the gospel." And I finally put it together. 40 years later, I'm like, "Oh, yeah, that makes sense."
That's it.
Yep.
You share the good news of Christ and of
Absolutely.
God's word,
That's right.
Yeah.
right?
Yep.
The good news.
I had a fourth grader sitting in front of me in a local area where I'd been called to serve, and I asked him a question because he was there on Christian education release time, which is another big thing that we've been a part of, where kids come off their public school campus, receive a Bible education in an hour, and they're sent back to school. Parent permission, off campus, privately funded, all that. And I asked him, I said, um, has anyone ever asked you if you'd like to meet Jesus? He said, no. Like he was just as honest, fourth grader. Uh, and I said, could I ask you that? Because we'd talked about God. He had great questions, all this stuff. He'd been hanging out, and I said, would you like to confess your sins to Jesus and give him a shot at taking over your life? And he said, yeah. Well, nobody had ever asked that question to him before. So my life, Wes's life, our message, wherever you catch us, that's our story. I gave my life to Jesus when I was 6.
Love it.
And decades later, have I been perfect? No, only he's perfect, but he has helped me so much. And so every day I get up, I'm like, somebody else has got to hear this. This is unbelievably great. They're going to get their life changed just like I've lived it. And so we tell kids, and I prayed with that kid that day. He simply said, Jesus, would you forgive me of my sins? Would you change my life? And I heard a neighbor down the street who lived behind him. She goes, what's going on over there? Like there used to be a lot of bad language, like
Sure.
big family. She said, something's different over there. And I told her, I said, well, this young man met Jesus. She goes, that's it. She goes, that's why.
Love it.
And we agreed that Jesus really does make a change.
Yeah.
Changed his
Yeah.
life. He's changed
Everything.
lives. I love it. Well, Dan, he's very inspiring, Wes.
He is.
And I love your smile. Your smile is infectious. And so, in today's age, not everyone's smiling. And, I guess you know who you are and whose you are, right? And
Amen.
so that's why you're smiling all the
Can I
time.
tell you my acronym for smile? I've had people accuse me
Please
that
do. I want to
that
hear this.
yeah, that I smile too much, and I was like, well, number one, it's genetics. So my mom and dad, they smile a lot, but I put my hand up and I said, simply remember this: smile means I live eternally. That's what smile
Oh,
means.
I'm going to write that one
Smile
down.
means I live eternally. If you know where you're going and who's getting you there, why wouldn't you? On the worst of days, with the most terrible challenges on earth that we all have, I'm going to look up because I know where I'm going. This isn't for keeps right here, but he is. And where I'm heading, that's why I'm taking millions of kids. Let's go.
Let's go.
Let's go.
All right. Listen, I'm motivated here. Well, Dan, it was great to meet you officially. And
Pleasure.
Wes, we're really excited about Blue Wave Concierge here on the Treasure Coast and Hope Sound.
Appreciate it.
And you're going to change some lives too, one patient at a time.
Amen.
One at a time. That's it.
I love it. I
Yeah.
love it. So we'd love to have you back on the show. We can maybe do something more specific towards your nonprofits because that's a whole show in of itself, Wes and
sure.
Dan.
Yeah.
So thank you for coming today. We enjoyed it. I loved it.
Our pleasure.
This was a great podcast. To be continued. You gained a new patient.
I
would be your new
appreciate it.
patient, and we can talk after the show here. And I'd love to come see the practice and your new facilities. They sound
Absolutely.
beautiful.
Yeah.
So thank you so much,
Thank
Wes.
you.
Appreciate it. Thank
Thank you,
Dan.
Glenn.
Appreciate it.
Appreciate it.
Amen.
Mhm.
Thanks, guys. So it was an hour. Clear.